Okay, so principle number one, if we want to deal with back pain successfully for the long term, is we have to get away with the notion of non-specific back pain. So what that basically means is that's like a sort of a kind of a throw out there term that someone's got back issues, they've got chronic back pain, had it for a while, no one really knows why. So they'll just say, oh, you've got non-specific back pain. So you've got back pain, we don't know what the cause is, you're just going to have to live with it, and that's that. Unfortunately, that is not the case. Well, fortunately, that is not the case. As any time that you've got back pain or back issues, there is always a cause or causes. Now, those causes might not be immediately obvious, they might be a little bit insidious, they might need a little bit of investigation to find out what they are, but they'll definitely be there. You know, no one just has random back pain for no reason, like some sort of phantom or spirit that kind of attacks you at will with kind of no prediction and no idea why it's happening. There will be causes. And that's one of the most important jobs that we need to do when we deal with back pain long term. I like to say there's two halves to the story. There's the most obvious half, which is exercises, stretches, mobility drills, whatever it may be that you need. But before you get to that, we have to get clarity as to understand why you keep getting these back flare-ups and you keep getting this back pain, because there will be aggravators, movements, postures, habits that you do, probably daily as well, that you don't realize that sensitize that back to pain. So these are movements and habits that if they weren't there, you wouldn't have back pain, but also it helps explain that cycle of good versus bad days, so that when you're not really aware of what's going on, the back feels pretty good, you might have some bad habits and movements that creep in. That sensitizes that back, gives you a flare up. Once you're in that flared up state, you're going to become a bit more aware of what's going on, you're a bit more careful, and that starts to let it settle down again. And again, then once it's settled down again, the bad habits come back in and the whole process starts again. So there will be movements and habits that we call aggravators that are sensitizing that back to pain. There's always a reason. And a good way to think about it is a bit like having, imagine you have like a cut on your arm, and you have the cut, you get it all dressed up, and ideally you would just leave it alone and you let it heal. The back is the same. Imagine that cut is your back injury, and rather than just letting it heal, you keep picking at it every 5 minutes, and then you wonder why it's not actually healing. So if you can identify the actual specific reasons why you've got back pain, the bad movements and habits, remove those, straight away the back's going to start to settle and it's going to start to be less aggravated and get it off that knife edge. But you have to get out the notion that back pain is some random thing and there's no real reason for it. Some people get it, some people don't. There are always reasons. And if we accept that, that actually kind of empowers us to think, well, there's going to be a solution somewhere. It might take me a while to get it. It might not be immediately obvious, but there is definitely a solution to it, and I can work towards that solution because I know there are problems that I can work on.